Hi, everyone. My name is Dr. Joy Houston. I'm the Vice Chair of Education for the Department of Psychiatry here at SIU. I'm here today to talk to you about patient safety and event reporting. Patient safety, of course, is all about how do we make care better for the patients we take care of and prevent medical errors. It's been estimated that as many as 400,000 deaths a year are due to medical errors. Even the articles that argue that that's an overestimate still place the total in the tens of thousands. So patient safety is very, very important because we work in imperfect systems that are going to make errors. We're all human beings. It happens, and we're always looking for how do we make the system better to result in fewer errors. It's also an ACGME requirement because patient safety is that important. The ACGME requires that trainees have access to safety reporting systems, be trained in how to use them, and be given data about what happens to those reports after the fact. Here at SIU, we actually go a step beyond that and require that everyone within their first year of training submit a safety event to either Memorial System, which is called Sensor, or to the SIU Alert System. Today, you'll have people walking you through how to submit within each of those systems. I'll be talking to you about how to submit within the HSHS Error Reporting System, which is called IRIS. Someone from Memorial will talk to you about how to submit into Sensor, and then someone from SIU will be discussing Alert with you and how to submit into that system. So thank you for joining us all as we learn more about patient safety and how to create better outcomes for all of our patients. Hi, everyone. I'm going to walk you through how to submit an event through the HSHS IRIS system. If you are not on an HSHS campus and need to log in remotely, then you will log in remotely to the site. You'll see I've already done that. What you'll do once you can see all of your applications is you'll click on the HSHS desktop icon. That launches the main portal page that you would usually see if you were on an HSHS computer. That looks like this. And you'll see that Iris is right in the middle of the middle column. So if you click on that, that opens up to this page, which allows you to pick whether this is an event, an incident, injury with a colleague, or a patient complaint or compliment. So we're going to click on an event. When you do that, that takes you to this form. And you'll note that everything with an asterisk is required. So it'll ask you the sort of things you usually expect, like what type of event, where did it happen, who was affected, was there an injury? For this, we'll say that we had a medication issue, and then it'll ask you for what specific type of medication issue, and we'll say incorrect dose rate. And then it's going to ask you who was affected, and you can say that it was someone who was inpatient, and so on and so forth. If you get down to whether an injury was incurred or not, you can say yes or no. There's also a drop down for event severity. We'll say that this was a near miss. It didn't actually get to the patient. If you go further down, there are also questions about whether you disclosed it to the patient and so on and so forth. And once you've filled out all of the required elements, then you come down to the bottom and you hit submit. Once you've actually submitted something, you'll note too that from this page, you can also visit the file tracker, which allows you to see where your event that you submitted is at in the review process. And so that's the rough guidance around how you submit a report for IRIS.
Today we are hosting a high-level training on the Memorial Health Patient Safety Event Reporting System known as Sensor. Providers can locate the Sensor application on the Citrix homepage on the left toolbar under the Tools tab or within the Cerner Power Chart on the top ribbon bar. Once you open Sensor, you will land on the Sensor homepage shown here, known as the icon wall. From this icon wall, you can enter a keyword in this white search box, which will then pull in any form that pertains to that specific matter to help you find the appropriate event form. You can also use the Info Center on the left-hand side to open up any incomplete events that you may need to complete to submit later. On the bottom left, you'll find your file tracker. On your file tracker, you will be able to use this to search the status of any previously submitted events. If at any point you run into any issues, you can always enter to get through the Memorial Help Desk and reference Sensor support. There's also a link located here on the icon wall under Need Help using that blue text. Today we're going to go over just a quick sample form as an example. In interest of time, I have completed a few of the fields ahead of time. A few high-level Key takeaways are to make sure that you complete each form in order from top to bottom, making sure you complete each field with a green asterisk, as that's the mandatory field needed prior to submission. The next thing is under any field name that has a dotted line, please make sure you hover over that. That will show you a definition that might be helpful for you to better understand the answer that we are looking for. Under the specific event type, there are several options to choose from. This is high-level categories, so if you can just do your best to ensure that you're trying to report what you think it may be. The important thing is that you're getting the event submitted, and our team can make sure it's in the right bucket going to the right leader. The next important field is our brief factual description. This is where you're going to tell us the details of the event. It does not need to be too long. We just need to make sure the leaders understand the details of the event. The next field I want to talk about is under the when and where section. The department field is where the actual incident occurred, if you can tell us where the incident occurred, and the other department involved is just that, another department that was involved in the event. The next important section is your safety event details, where your harm level reported lives. If you do the drop down on your harm level reported, this will give you several different options to choose from. If you hover over each of them, it will give you a basic description to better understand. In this case, this was a labeling issue, and the labeling issue caused the provider to have a delay in care, so the event did affect the patient, making it a no harm event. If the event had not affected the patient in any way or the timing of their care, it would be a near miss or unsafe condition. The next one I would like to show you is this person affected section. Anytime you notice there's a magnifying glass, this gives you a search option to use. Feel free to go ahead and hit enter last name, first name, and then hit search, and that will pull in the patient's information from Cerner. If you do not have Cerner or you are unaware of this information, you will need to go ahead and enter each field manually. Once you complete those fields, feel free to let us know if there's any parties involved. Feel free to go ahead and hit add and then enter any of that colleague information. Once you've completed those fields in order from top to bottom and all of the mandatory fields are completed, you would enter submit. If for some reason you run out of time and you need to come back to this, you would hit more actions, save as incomplete, and then later you can go back to your info center to complete that. I have created a quick little provider tip sheet that goes over some of the things that we discussed today. If you find this would be helpful, please enter a Memorial Help Desk ticket, reference sensor support, and ask for that provider sensor info sheet. Thank you for watching, and reach out at any point if you have any questions. Thank you.
SIU Medicine uses the Automated Logging and Event Reporting Tool, or ALERT, for reporting incidents. Any member of the SIU team can submit a report. Some reporting is even available for patients and visitors to submit compliments or concerns. You can access ALERT through the link on mysiumed.edu, through the alert icon on the Hive, or as we will do today, the SIU alert icon in Citrix. You can also bookmark the page or follow QR codes on postings in various clinical locations. You can complete reports on your phone or on a computer. On the Alert launch page, you have multiple options for types of reporting forms. If you are not certain of the type of form to select, you can hover to discover by placing your cursor over each icon for additional information and examples. Please note the email at the top of the launch page goes to the entire Patient Safety and Clinical Risk Prevention team, as does the HALO group, SIU Patient Safety and Clinical Risk Prevention. We are glad to assist with any questions regarding an event or completing an alert. Feel free to reach out through either method and we will respond promptly. For this example, we will use the patient and visitor behavior form. Once you select your form type, you will be asked questions based on the type of event. Fields marked with an asterisk are mandatory. Of note, some of the other form types may allow for anonymous entry, but we want to make sure the reporter includes as much detail as possible before submitting. If the report is anonymous and details are missing, it's not possible to contact the reporter for further information. This will hinder and prevent complete follow-up. If you do report anonymously, please be sure to review for complete information prior to hitting submit. There will be drop-downs to select the department and division where the event occurred. If you're at a location not included in the listing, such as a non-SIU location, you can select Other. This is important information to ensure follow-up is directed appropriately. You will be asked 2 questions regarding the type of behavior noted. The first question will ask for primary behavior. This will be the most significant behavior warranting a report and will be used in further reporting of data. The second question asks you to identify any additional behavior since there can be more than one present, and we want to capture the full picture to be able to track accordingly. Based on answers in the forms, you may be prompted for further information, including for abusive and disruptive behavior, you will be asked if injuries occurred, and for property damage, you'll be asked for details regarding that property. There will be questions regarding details of response, notifications, and witnesses. The final field will be to include any further information not listed above. Please document facts with as much detail as possible, including actions by the individual or staff, including de-escalation attempts. Statements should be documented, including quotations and asterisks if needed, but reporting of exactly what occurred is critical in evaluating what further follow-up or actions may be warranted. If you need to add attachments, such as a PDF file, you can select that box prior to submitting. Once you complete all mandatory fields, you can click the blue Submit button. If you did miss any mandatory fields, you will be prompted to complete those fields before hitting Submit. Once successfully submitted, you will receive a pop-up showing it was accepted. You can enter your email if you wish to receive a link to be able to check for the status of the report. That will not include details of the review, but will indicate if the file is in review or closed. The report will then be moved forward and directed to the appropriate areas for follow-up. If at any time after submitting you have additional questions or information to add, please reach out to Patient Safety and Clinical Risk Prevention, and we can assist. Thank you for reporting so we can continue to work together to provide a safer environment for patients and staff.